Hi, my name is Jen. I woke up this morning trying to read about the brain and I found out something interesting. I learned the brain helps us to think, to express our emotions, to work, to control our senses and other organs. How important? One thing I didn't know for sure was that the brain can be vulnerable to diseases. I decided to ask my friend who apparently is a doctor.
Hi, my name is Dr. Tom. Brain disorders taken together account for about 13% of the global burden of diseases, a high number compared to the cardiovascular and cancer diseases. Do you want to know more? Let me explain to you what I know. There are various categories of brain disorders. You can have infection like meningitis, trauma like concussion, especially in contact sports, can have tumors, masses in the brain. There are also neurodegenerative conditions like Parkinson's disease and Alzheimer's. Can have also autoimmune conditions. These ones include multiple sclerosis. Can have vascular conditions like a stroke and also mental health disorders like depression and schizophrenia. Meet Joy, one of our patients who is suffering from brain disorder and has some questions. Jane, do you know some risk factors and causes of brain disorders?
No, doc?
Do you want me to enlighten you?
Yes, please.
Brain disorders can affect anyone. You can be born with them. You can also get them from some genetic mutations or some illnesses like after having an infection. You can also get the brain disorders if you do contact sports, like you play rugby or boxing. From old age also, you are more likely to have brain disorders. And if you take alcohol and use drugs in an extensive way, you will be more at risk. A family history of brain disorders, if you have had a person in your family with a brain disorder, you are also at risk of having a brain disorder. Having comorbidities like hypertension, diabetes, and other cardiovascular diseases also poses some risk on you to have brain disorders. Stress, trauma from a stressful event or something that have happened in the past also pre-expose you to these risks. Chemical materials like radiation also is a risk for getting brain disorders. In Africa, the most common causes of brain disorders include malnutrition, adverse prenatal conditions, malaria, HIV/AIDS, also not getting vaccinated, different kinds of demographic transition, and vehicular traffic. Coming back to Rwanda, brain disorders most common include epilepsy. Epilepsy is a medical term for recurrent seizures that are due to abnormal brain activity. In a study that was conducted in 2005 in Rwanda, it was found that epilepsy was prevalent to a level of 49 people in 1,000 group. It was found that male were more affected by epilepsy than female, with a ratio of 1.16 to 1. Another study was conducted in 2008 with data representing the whole country, and it was found that epilepsy was prevalent to a level of 0.7%. There are various causes of these seizures which, when recurrent, are called epilepsy. They can be acquired from birth due to a delivery complication like a fetal prolapse. They can be also acquired from a childhood illness like meningitis, malaria, measles, and tinea, especially in people who have contact with animals like pigs. Can also be acquired from head trauma after an accident. There are various symptoms of epilepsy. The most common ones, most seen, being fainting, fatigue, shaking with spasms, losing consciousness, confusion, weakness, having strange sensations, and some oral secretions. One of the other most common brain disorders in Rwanda is post-traumatic stress disorder, which is more common even in the 1994 genocide against Tutsi survivors. Post-traumatic stress disorder is triggered by a terrifying event that a person has witnessed or experienced. The global prevalence of post-traumatic stress disorder or PTSD is 2 to 3 over 1 ratio in male versus female, with male having the highest prevalence. There are some symptoms associated with PTSD, like flashbacks, a feeling like you are living the same experience that you have witnessed or experienced in the past, nightmares, severe anxiety, uncontrollable thoughts, and avoiding places or thoughts that might bring you to witness or experience the same event again. Another common brain disorder in Rwanda is schizophrenia. The New Times have defined schizophrenia as abnormal social behaviors from failure to understand reality. It is prevalent in the world to a level 20 million as for the 2017 study. The prevalence of schizophrenia was also higher in the 1994 genocide against Tutsi survivors, especially who lives in rural areas. There are some misconceptions regarding schizophrenia in Rwanda. Some people believe it's from a malediction or it is from witchcraft. Various causes of schizophrenia include trauma from an experience that you've had in the past. It can also be inherited across families. The symptoms of schizophrenia include having false beliefs or delusions, having hallucinations, hearing voices or seeing figures that are not present in reality, detached from reality or psychosis, and we often see people moving around in the streets collecting papers, sometimes having poor hygiene as mentioned by the New Times. There are some other symptoms of brain disorders which are non-specific. They include nausea or vomiting, headache, agitation or mood changes, confusion or forgetting things, depression or anxiety, social isolation, fever, chills, changes in speech, vision, or other senses. Jane, I know it was well to take in. Before I continue, have you read about anything the government of Rwanda has been doing to alleviate this burden of brain disorders?
Yes, of course. The country has embraced some success towards alleviating brain disorders, one being facilitating training of more physicians who are able to diagnose and treat effectively brain disorders. Nurses has also been trained so as to decentralize mental health services at the health center, to mention a few. However, a lot of gaps to be fulfilled remain, with the first one being the scarcity of resources, including hospital equipment and human resources. Research has shown that in low and middle income countries we have 0 to 0.1 neurologists per 100,000 people, comparing to 7.1 per 100,000 people in high income countries, which shows the gap in human resources in low and middle income countries. Another good example we can see is on the psychiatrists. For instance, in Rwanda, in 2020 we only had 13 psychiatrists in Rwanda. Apart from the gaps to be filled, we also have some challenges the countries are facing currently about brain disorders, which include misconceptions where some people think that brain disorders are caused by witchcraft or any other condition. And also we still have some stigma where people with brain disorders are stigmatized and they are unable to seek medical support because they feel like it's a shame to have brain disorders. And we also have limited knowledge about brain disorders, which create these misconceptions and prevent people from also seeking healthcare services. So Dr. Tom, is there anything you would recommend that would help us to fill the gaps and prevent these challenges?
Of course. One way to tackle this is to destigmatize mental health. Mental health has a lot of stigma around it in Rwanda, and with proper sensitization, providing information about mental health, this would decrease the incidence of undiagnosed and untreated mental health disorders. This would be done also through mental health campaigns. By decentralizing information about brain disorders, awareness can be increased about how they come about and where to seek help, especially in rural and uneducated communities. Collaboration between different stakeholders can create support in terms of workforce and resources, which are still scarce in low and middle-income countries. Worldwide movements can also come to protect societies from exposures and risks. For example, if they reduce and regulate industrial radiations and screen products for carcinogens and protection of players in contact sports. There can be also prevention on an individual and society level. One can do this by exercising regularly, taking a healthy and balanced diet, having enough sleep and rest, having healthy social relationships with friends and families, avoiding extensive sun exposure, and seeking help earlier so that they can be treated and cared for earlier. Jane, are you satisfied with my recommendations?
Thank you so much, Doctor, for explaining everything. I have learned a lot from this conversation. I hope everyone who was following us have also learned a lot too. So if you have any questions or more concerns about brain disorders, mental health, or any other condition, please feel free to reach out to the nearby health center or hospital and reach out to doctors and nurses to explain everything. As we have told you before, mental health has been decentralized. Thank you.